Hello class 7 students, welcome back to the Civics session. Today we are going to start chapter 2 of Civics, which is Role of Government in Health Sector. Learning objectives: health, public healthcare services, healthcare and equality. Is adequate healthcare available to all? Healthcare in India, private healthcare services. Let's warm up. Look at the following pictures and identify which health sector do they belong to. Application skills. In order to prevent and treat illness, we need appropriate healthcare facilities such as health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc. that can provide the required care and services that patients need. In order to run such facilities, we need health workers, nurses, qualified doctors, and other health professionals who can advise, diagnose, and treat illnesses. We also need the medicines and equipments that are necessary for treating patients. These facilities are required to take care of us. Now answer the following questions. A. Why do we need healthcare facilities? B. What do the healthcare facilities do for us? C. What other things do we need besides healthcare facilities? Answer these questions by yourself. This is the image of healthcare facilities. Health. In simple words, health means our ability to remain free from illness and injuries. But health is not only concerned with diseases. Some other factors also affect our physical and mental well-being. These factors include sanitation, clean drinking water, pollution-free environment, sufficient and nutritious food, proper shelter, and a life without mental strain. All these aspects are part of our health. Fact file. India is the fourth largest producer and exporter of medicines. Healthcare in India. The state government is responsible for planning, implementing and monitoring schemes to improve public health. So it sets up health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc. In order to run such healthcare facilities, health workers, nurses, doctors and other health professionals are also employed. These people advise, diagnose and treat illness. We also need medicines and medical equipments for treating patients. Our state governments make arrangements for them. In India, the government's efforts to improve public health have been focused in the 5-year plans on coordinated planning between the states and the center and on sponsoring various health programs. The government expenditure on health is jointly shared by the central and state governments. Let's read the following story and try to understand strengths and weakness of Indian health system. Manish and Shekhar are two good friends. Manish belonged to a poor family while Shekhar belonged to a rich family. Both once fell sick. Manish went to a government hospital where there was a long queue at OPD. After that, he had to wait 2 hours for the doctor to check him. Then test took another 3 hours. The result came out after 4 days. He spent nearly 5 days and around 50 rupees to get treatment. On the other hand, Shekhar went with his father to a private hospital equipped with all modern facilities. The test report came out in an hour and the treatment was available within 3 hours. Shekhar spent over 5,000 rupees for the treatment. In these images, you can see less facilities in a government hospital, good facility in a private hospital. Think and discuss. What is the difference between Manish and Shekhar? Does it affect their medical treatment? What is the difference between private and public healthcare in India? From the above story, it is clear that there are two types of health services, private health and public health services. Think smarter. Why do you think healthcare persons are not willing to take up the jobs in the village? How do you think health of the country will improve if the majority of the people living in villages do not get adequate healthcare facilities? Public healthcare services. Public healthcare services include the whole chain of health clinics and hospitals operated by the government. All the hospitals are linked and both rural and urban centers cover treatment from common illness to special services. This is the image of a government hospital. In villages, the government provides a health center with a nurse and village health worker. working under the superintendence of doctor at the primary healthcare center (PHC). At the primary health center (PHC), at the district level, district hospitals are provided while large cities have multi-speciality hospitals. These hospitals are called public as the government provides healthcare to all citizens and the resources required to operate these come from taxes paid by public. An important feature of this system is that the public healthcare comes for free or at a low cost. Thus, government takes care of health by preventing spreading of diseases like malaria, jaundice, chikungunya, diarrhea, tuberculosis. For effective implementation, it is necessary to involve people in organization of programs for this purpose. It is the duty of government to ensure right to life to all. For this, it is essential that people get timely treatment, especially during emergency situations. Drawbacks of public healthcare services. Despite all efforts of the government, the public healthcare system does not reach the common man who needs it most. The reasons are as follows. Number 1. Funds provided by the authorities are very meager and often not utilized. Second, skilled dedicated doctors are unwilling to serve in rural areas, resulting in a huge shortage of trained medical personnel. There is a lack of infrastructure in the rural areas. Taking patients to hospital is a common problem. Most public health facilities provide only basic care and have poorly maintained medical equipments. The number of public health facilities is also inadequate. There is a shortage of community health centers and qualified doctors and nurses, especially in the villages. This is the image of patients in a government hospital. Fact file. The National Rural Health Mission (NRHM) provides every village in the country with a trained lady community health activist, ASHA, or accredited social health activist is trained to work as a link between the community and the public health system. ASHAs are responsible for promoting universal immunization, healthcare programs, and construction of household toilets. They create awareness on health by providing information on nutrition, sanitation, and hygiene services available at the Anganwadi and primary health centers. Private healthcare services. Private healthcare services have increased tremendously in the past few years. 75% of healthcare is now provided by the private hospitals and doctors. This is the image of a leading private hospital in a metro city is very expensive. There are super specialty hospitals and private clinics of doctors. The private hospitals are modern, clean and attract the middle class as well as the rich. Most government hospitals are unclean and disorganized. So people prefer going to private hospitals. However, private healthcare facilities are mostly found in cities. They are expensive and hence the common man cannot afford it. Only if there is a public-private partnership, we may be able to achieve the dream of providing quality healthcare to all. Healthcare and equality. Is adequate healthcare available to all? In India, private health services are increasing, but public health services have deteriorated. In most of the urban areas, private services are run for profit. While medicines are expensive, majority of the population cannot afford the treatment. However, private services even misuse their services by recommending unnecessary medicines, injections, or saline bottles. When mild medicine can be very sufficient in India, hardly 20% of the population can afford the expensive medical treatment due to poverty and hardships. At times, people have to borrow money or sell their possessions to pay for the expenses. This situation happens again and again. Poor people are malnourished, they do not have proper drinking water, adequate housing, etc., and therefore they fall sick. Sometimes shortage of money also prevents people from getting proper treatment. Health of women and of tribal are the two major areas neglected in India. In the loop. In rural areas, private doctors operate as registered medical practitioners (RMP). Let's look at this case study. Social sector development in Kerala in 1996. Kerala is one of the most progressive states in India in terms of social welfare and quality of life. It's all because of the efforts of various government programs like public distribution on essential goods, Anganwadis, free insurance schemes for BPL families, etc. High quality life is facilitated by the pollution-free environment to the people of Kerala. Education and awareness levels of women are comparable to that of men in Kerala. Kerala has fairly good distribution of health facilities in the public sector. There are PHCs, CHCs and hospitals at every level, specialized clinic for TB and leprosy control. In 1996, the Kerala government made some major changes in the state policy. 40% of the entire state budget was given to panchayats. They could plan and provide for their requirements. Panchayats prepared proper planning for water, food, women's education, etc. Health centers were also improved. All this helped to improve the condition of the state. The Costa Rica approach. Costa Rica has the best health facilities among all countries in South America. The publicly funded comprehensive healthcare system has brought this country's health indicators in line with those of OECD, Organization for Economic Cooperation and Development countries. One reason for the success of this system is the large contingent of the mid-level workers who effectively extend health programs to rural areas. They are much cheaper than doctors. The government of Costa Rica provides all the basic amenities like safe drinking water, housing, sanitation, and nutrition to all its citizens. Health remains a primary agenda for the government. Value and life skills. The Medical Council of India's Code of Medical Ethics states every physician should, as far as possible, prescribe drugs with generic names, and he/she shall ensure that there is a rational prescription and use of drugs. What are generic medicines? Search internet or ask your parents about them. Write their benefits. Recapitulation. Health means our ability to remain free from illness and injuries. Public health services include the whole chain of health clinics. The public healthcare system are not adequate for all the citizens of the country. Costa Rica has the best health facilities amongst all countries in South America. It is the responsibility of government to provide health services to every person at a very reasonable cost. Thank you class. Let's meet up again in the next chapter.